Welcome, everyone. Thank you for joining us on the April All-America City Promising Practices webinar, Community Approaches to Inclusive Healthy Housing. My name is Rebecca Trout, and I am the director of the All-America City Awards program here at the National Civic League. This year, the National Civic League is turning 125 years old, and we are a nonprofit that aims to advance civic engagement to create equitable and thriving communities. A little bit about our flagship program, the All-America City Awards. It began in 1949 to recognize exceptional civic engagement in local government. The 2019 theme is creating healthy communities through inclusive civic engagement. And it's a really exciting time for us right now as we're preparing for the All-America City Awards here in Denver in June. We have a really great group of finalists this year, and we have a wonderful program planned. We would love for any of you to join us at the event, so I'll be including registration information for that event in my follow-up email in case anyone is interested. And while AAC does celebrate great work through our awards program and competition, we also aim to share those innovative best practices, initiatives, and projects from around the country through avenues such as this monthly webinar series. So today we'll be learning about programs that are intentionally promoting and creating inclusive, healthy housing. First up, we have Emily Yu, who will give an overview of the Build Health Challenge. Emily will then hand it off to Suzanne Mineck, who will speak to us about Healthy Homes Des Moines. And then last but not least, we'll be joined by Leroy Moore from the Tampa Housing Authority, who will discuss their work and specifically Encore TAMPA. We will have an opportunity for questions, but we want to address those at the end in order to give all of our presenters enough time. So if you do have a question, please just jot it down in the chat box, and we will give the presenters an opportunity to answer those at the very end. So without further ado, I am going to hand it off to Emily, and she will get us started. And Emily, sorry, you are currently muted. You were call-in user 3.
Can you hear me now?
There we go.
How's that?
I can hear you.
Oh, perfect. Sorry about that. Thank you so much, Rebecca. So sorry about the technical difficulties. So thank you all. Thank you to Rebecca for having me here, and I'm so honored to be here with Suzanne and Leroy. I think the stories that we'll share will really complement one another and hopefully give you a more well-rounded view of some of the upstream social determinants of health work happening across the country. So as Rebecca mentioned, my name is Emily Yu, and I have the honor of leading the Build Health Challenge, which I'm here to tell you a little bit about. For context, I just wanted to sort of tell you a little bit about the premise of Build and what it is. It's a national awards program that really is a funding collaborative. It's resourced by a number of different funders. First cohort was 5 funders that came together, and then it grew to 11. And that's actually how I know Suzanne and have the benefit of working with her. In the second cohort, these communities were chosen to come together. They all had a firm belief, along with the funders that participate, that health isn't really made in a doctor's office, right? Sure, healthcare is very important to the well-being of individuals across the country, but really an outsized effect is on the air you breathe, the food you eat, essentially, where you live, work, and play. And oftentimes we found, especially in the work that we do with Build Health Challenge, that, communities may not be as well resourced when it comes to addressing those upstream efforts, things like transportation, food insecurity, or even violence prevention, things that, again, impact where you live, work, and play. So these are the current funders, and you'll see Suzanne's organization proudly represented there as the Mid-Iowa Health Foundation. We also are honored to be joined by several others, both national and regional funders. It's one of the nice features about the Build Health Challenge, actually. They come together and they bring their expertise and resources to bear. And to date, in the second cohort, we're actually funding 19 different communities across the country. I'll tell you a little bit more about their work. But the context and the thread that brings us all together is really that we're committed to contributing to this new norm in the U.S., one that, as I alluded to, really pushes forward this idea of multi-sector and community-driven partnerships, all through a lens of health equity, really in service of improving health for everyone. And the way that these communities do that and the framework that has brought us all together is really this bold, upstream, integrated, local, and data-driven approach. And it stands for BUILD, as you can see here. And what's nice about BUILD is it's simply, and I say that tongue-in-cheek, it's simply a framework, right? These are concepts, these are principles that the original funding group really thought would make an impact and really help shape the way communities could move forward, but in their own way, right? So each community is asked to think about their particular challenge, their priorities, and together, again, with community residents at the forefront, decide how best to apply the BUILD principles. So in short, B for BOLD, that's really about the systems change, really those longer-term sustainable policies or practices. Upstream, you find being those where you live, work, and play elements that I alluded to earlier, really the social determinants of health and focusing on those, as opposed to, for example, service delivery or one-on-one individual care. I is for integrated. Core to BUILD, each group that applies actually has to be led by a community-based organization. They have to be in partnership with a hospital or health system and have the public health department be involved. And beyond that, we welcome many, many additional partners and community residents. But again, at the core are those three groups structurally and logistically. Interestingly enough, the hospital and health system must also bring to the table a match, and BUILD provides funding to match theirs one-to-one. L is for local, and that's really to put the sort of priority on community-driven leadership and engagement. And finally, D, data-driven. Again, this is really in recognition to knowing and realizing that no project of this sort of scale and within such a short time frame of about 2 years can really function and reach its goals without a focus on data collection, analysis, sharing, and all of these principles are all grounded in health equity, as I mentioned about our mission. So moving upstream, I told you I'd share a little bit about what some of the sites are doing. You'll hear very shortly from Suzanne, who's helping lead the work in Des Moines on healthy housing and asthma as a teaser. But we have other sites that are working on everything from wellness hubs to really transportation, maternal and child health, opioid addiction, working through medical legal partnerships. BUILD as a program is issue agnostic, and so we're really excited about, and really the premise is about casting a wide net. And what can we learn from these communities that really know best about how to apply the BUILD principles to their own work? And what can come out of it from both a systems change, long-term level, as well as a health outcomes level. And we think when we pair all those learnings together from the communities that are really at the forefront of this work, we can pull together information and learnings that can help other communities replicate and scale this work. And so I'm going to sum up here, but essentially to date, in just the first 2 cohorts over 3 years, BUILD has had really quite a privilege to work with over 37 communities in 21 states and DC. And so lastly, I just want to end and hand it off to Suzanne, actually, with just a nod. This is a picture of some of our second cohort awardees and funders and stakeholders, without which BUILD would not exist. But these are just some of the faces behind those 37 projects that I just showed you that are really, again, representing community-based organizations, public health departments, hospitals, and resident groups. And so with that, I'd love to turn it over to Suzanne.
Excellent, Emily. Thank you so much for that. And Suzanne, you should be able to share your screen now.
Okay, good afternoon, everyone. Oh, where did it go? Can you hear me and see my?
We can hear you, and you're sharing your screen, but right now it's black.
Oh, I had this all ready to go, and now, of course, it's not working. So sorry, everyone.
So what we can do is I can share your slides, and then you can just tell me next slide.
Yeah, I'm so sorry. It seems to not be, it worked earlier.
It sure did. That's okay, that happens sometimes.
Oh, wait. Okay, this is yours. So, yes. You can go to the next slide, the intersection of health and housing. I'm so sorry. Okay, so this is Suzanne Mineck, and I have the privilege of serving as the President and CEO of Mid-Iowa Health Foundation. Today I'm going to share a little bit about a program our foundation has been involved with, I would say even prior to day one, if that's fair to say. Our current funding priority as a foundation is really focused on accelerating action and catalyzing innovative system-level solutions to the most pressing health needs of our children and youth in our community. And so hopefully what you'll hear in the next few minutes aligns with that. Healthy Homes Des Moines really is based on this intersection of health and housing and the powerful and sometimes devastating effect that substandard and unhealthy housing can have on our children's health. If you want to go to the next slide. So let me share a little bit about where this began, because I think it's important, as Emily raised, that this is always based in the voice of our local communities and where the needs really exist. Our foundation was funding a project with our public school system to help incoming refugee families better access a medical home. And I had the privilege of meeting a mother whose son the initiative was working to help. And she spoke very little English, but enough to share with me that she could bring her son to the doctor every day, but please understand that if I bring him home to cockroaches, rats, and no heat, he will never be healthy. And that's really what catapulted our foundation into a new level of engagement on this health and housing issue for our community. You can go to the next slide. So we began pulling leaders together, and as Emily already alluded to, the integrated part of bringing health and other systems together was part of where we stood. And then we learned about the Build Health Challenge and decided to apply based on the data that we had also been collecting. And again, this was leveraged off of the local voice of our community. And the data was showing us really the high number of kids we had in our community living in certain zip codes that were presenting at the ER with uncontrolled asthma. You can go to the next slide. So here are some of the partners we were able, in addition to Build, to pull together. And one thing to note, in addition to housing, is we had all three of our major health institutions step forward. So Emily mentioned that the criteria for Build is that you have one system. We were able to leverage and have all three be part of this collective impact effort. You can go to the next slide. So here were our goals of this initiative from day one. We really wanted to reduce the number of ER visits We wanted to reduce absentee levels in our classrooms. That then really aligns with fewer days of missed work for caregivers. Obviously, increase the level of housing in our community, and really elevate a broader awareness across our community that where you live has a profound impact on your ability to be healthy. Next slide. So it's pretty straightforward. The eligibility is either a diagnosis of asthma or an airway disease. Our age demographics that we're targeting is 12 to 18. We started in one zip code. We then moved to the city. We're now in our kind of central Iowa, Polk County area. And the eligibility is equal or less than 80% of media area income or Medicaid eligible. Next slide. So this is how it works. In order to be referred into the program, a child and family must be referred by their physician or school nurse, or we are now trying to work with our managed care, Medicaid managed care organizations to refer directly into the program. There is then an assessment that's done in the home based on that referral. And I love this part of our program. We go in with both a Healthy Homes expert and a visiting nurse. And so the likelihood that a housing issue and asthma is the only issue that maybe that family is tackling is low. And so our visiting nurse has the ability to not only educate on asthma, but try and identify what are some of the other barriers that that family has with regard to being healthy, and how can we better connect them with resources across our community. If there are indeed environmental issues that are seen to perhaps be triggering the child's asthma, we then do the appropriate home remediations. And this has been a big learning for us. You know, I think we went in expecting that to be a massive undertaking and maybe bills that we would have a hard time identifying dollars to address, but really our average has been, the cost has been in the $4,000 to $5,000 range per house that we've had to really go in and address those issues. So not as much of a barrier as you might think. And then the ongoing, as I said, care coordination and asthma education, and we continue to stay in contact with those families. If they don't need home repair, we still provide them with non-toxic cleaning supplies, a HEPA vacuum, and like I said, those ongoing referrals to other resources that may be helpful. Next slide. You can go on to the next one, actually. So as I mentioned, the referrals come from our healthcare providers and our schools. You can see here that majority still come from our health system. Next slide. Another interesting component is many of our members of our community are living in rental housing in these zip codes, and this has been a big barrier for us to try and help, because the number that were living without proper lease agreements and felt they had no voice. So we've had to bring in Iowa legal aid to help ensure that we weren't causing more risk to a family by trying to help. You can see that a majority of the individuals that we've been able to serve are served under Medicaid, and then a blend of racial demographics. Next slide, please. So we've had some really great success we've had a 60% reduction in asthma-related ED utilization, which for those of you in the healthcare industry, or if not, you can see really what, instead of the icon there of a hospital, we should have a dollar sign, because that's real money for families and for our healthcare system to have that percentage of reduction. We've had a substantial reduction in days of missed school and then related work days missed for parents and caregivers. Next slide. We've also received great response from our parents and just the level of stress reduction that feeling supported in this challenge with their child and family has provided, and our children have had an average of 6 more symptom-free days per month. And you think about these little kiddos out and their ability to be outside and be on the playground and engage in activities, those are powerful numbers. Next slide, please. I think part of the build approach, and for sure our approach in our local community, is how do we create more of a ripple effect, not only with the individual families we work with, feeling more empowered around the health of their family and their home, but then how does that ripple across our community for more education and awareness that this is something that collectively we can better respond to the needs of our families. Next slide. You can go on to the next one. Sorry, that one didn't need to be in there. You know, it's interesting that these have been the most common discoveries we've had in homes, and again, I think this list is reflective that we can do something about all of these. And so the lift as a community is actually not as significant as it might appear. Next slide, please. If you're interested, you can go to healthyhomesdesmoines.org, and this shows you how a referral can happen and just get a sampling of what that looks like. Next slide. So here's where we're headed. Obviously, we've moved from zip code to city to county. I would say our greatest effort right now in the system change approach to this is twofold. From the health perspective, we are rigorously working with our managed care organizations, our Medicaid managed care organizations, to create a reimbursement mechanism. So these, as I mentioned earlier, these are real dollars that are being saved for our healthcare providers, and even more so for our third-party payers. If we can keep kids out of an emergency room and the ICU, those dollar figures of savings are of interest to our managed care organizations. Finding the best way to be in that relationship and for that reimbursement to take place has been a massive challenge, and I will tell you we're in the thick of it right now, trying to come up with a process that our managed care organizations are willing to engage in. Along the same lines, we're working really hard on housing policy in our community. What is it we can do, again, at a system level, to ensure that more of our housing stock in this community and state is of quality before any family moves in? So whether that's rental code issues or purchase code, what is it we're doing upstream on the front end to create healthy housing environments for our community? Next slide. next slide, and I'll just end with a story. Actually, our very first home we went into now 3.5 years ago probably, was a family. They had a young boy. He was just about 2, and he had repeatedly been in the ER in the ICU with airway, asthma, significant issues. I recall we went in that first home and identified some environmental issues we felt we could address. And I'm saying we here, of course, it was all of our partners that were doing it. One of the issues, they needed a new roof. And so it came to a little over $8,000 that we invested in that home. As we were doing the repairs, the mom dug out of a drawer a whole stack of hospital bills and showed the visiting nurse these hospital bills, and they totaled more than $80,000. So again, we invested a little bit over $8,000 to fix this home. In the 18 months, 2 years following, that beautiful little boy has not been back in the ER or ICU. And they've now had a second child who has been healthy. So as a foundation invested in the health of and well-being of our community, clearly you can see we felt this has been a really great return on our investment, and we've been immensely grateful for the Build partnership that has allowed our community to do a deep dive into this issue. So that's it, Rebecca. Thank you for managing my slides.
Absolutely. Thank you so much for that presentation. Really, really fascinating stuff, and very powerful story to end it. We did have a couple of questions come through for both you and Emily, but as I mentioned, we are going to save those for the very end. And now we will be joined by Leroy Moore from the Tampa Housing Authority. Leroy?
Okay. Look at we too small.
Living community Encore. Tampa Housing Authority is a public housing agency.
It sounds like you were muted for just the very beginning of that. If you wouldn't mind starting again for us.
Certainly. Good morning and good early afternoon, everybody else. Leroy Moore, Tampa Housing Authority. Just before I get started with the actual case study, I'd like to just give you a little bit of background on Tampa Housing Authority. We are a public housing agency located here in Tampa, Florida. We manage about 14,000 units of housing, affordable housing for families that are income eligible in the city. Our portfolio consists of about 5,000 hard physical units, actual units, and the rest of those units are provided through the form of a subsidy paid to landlords to allow our residents to live on the private market. Our properties are scattered throughout the city of Tampa, as you can see here. So we're not segregated in one particular area. That's sort of one of the first no-nos in I think, planning for good, inclusive communities, healthy communities, is that, the quote, your community's poor shouldn't all be relegated to one particular section of the city, but should be able to live, prosper just like everybody else throughout the broader community. So we have properties, public housing communities, as far north as our city limits, as far south as our city limits, to the east as well as to the west. I'm going to focus a little bit on the center. This is our downtown central business district right here, downtown Tampa. And we have a property located immediately north. It's actually part of the central business district called Encore TAMPA, which is going to be the focus of my presentation today. So this is Encore Tampa. This 12-city block area is 28 acres, formerly Central Park Village public housing. And our downtown, as you can see, the real heavy part of downtown is here. This is our channel side where the cruise ships come in. Ybor City is our multi-billion-dollar entertainment district, historic entertainment district. The Hillsborough River, which is the western edge of our downtown community. And I just highlight this area because our next project that's actually underway now, West River, on the west side of the Hillsborough River, will have similar healthy features integrated in it. Because of the river, it gives us, a lot of, activity to walking paths and bike paths and ways to connect that community to the broader neighborhood. This is what Central Park Village looked like in 2006. These barrack-style green buildings, looks like a military base. That's how public housing was built back in the 40s and 50s. Central Park Village was 78 years old when we tore it down just a few years ago. And right in the middle of the site was a alternative education school. It was the school where the school district would send all of the kids that were not able to attend regular public schools because of behavioral issues. So not only did you have a distressed public housing community that lacked investment, proper investment by public and private sector for decades, it was that isolated pocket of poverty on our downtown skyline. It was, a super block of housing where all the streets just sort of went around the community, once again further isolating that community. All of the worst planning principles of the last 5 decades were inherent in this community. And it was our site of last resort. When we relocated the families there, tore down those 483 units of housing and started building Encore Tampa, which this is what it looks like today. There's 4 buildings that are vertical and occupied today, 662 units back on that site, approximately 200 units more than whatever existed on that site for 78 years. Those 4 buildings are mixed income buildings, meaning we actually have low-income families living alongside of market-paying families, market-rate families. It's a very integrated community. It's a green community. It's a walkable community, bikeable community, close to our downtown job base, so that individuals that live in downtown or live in Channelside or live at Encore could actually have jobs within walking distance to downtown, to Channelside, to Ybor City. Incredibly high number of jobs in our city are located in those areas. Of the 662 units, 559 are affordable to families earning below 60% of area median income, and 103 of those units are market rate. We have other uses coming on that site as well that I'm going to talk about right here. This is that site again. Lot number 1 here is actually a new school site. That school will not be built for another 5 years. So for the next 5 years, we're actually in permitting right now for a 2-acre urban farm to take place on lot number 1. Once again, a specific feature that we wanted integrated in this healthy community because access to locally grown, good fresh fruit and vegetables, organic produce is this area was a food desert and still is a food desert. We're still trying to attract a grocery store for lot 12. So eventually we'll have a grocery on lot 12. We'll have restaurants, more restaurants than there are now located along the town square here, and they will have the option, the availability of actually getting their locally grown fresh fruit and vegetables for sale within their establishments from on site, which virtually eliminates the transportation costs and gets those healthier produce items to the plate a lot faster. Lot 2 is the Temple at Encore. That's the building that we just finished in January. It's now being occupied. That's 202 units of family housing. 30% of those units are market rate. 70% of those units are affordable. Lot 3 was the first building we finished, the Ella at Encore, a senior building, meaning for senior citizens, 62 and older, 160 units, all affordable. Lot 4 also is a senior building, 158 units, all affordable. Lot 7 is another family building, 142 units, called the Trio at Encore. The Trio is 70% affordable, 30% market rate. We have under contract a hotel for Lot 10, a 200-unit hotel with 150 condo above and 60,000 square foot of office, scheduled to break ground before the end of the year. Also before the end of the year, and also under contract is Lot 9, a 250-unit market rate rental building. Soon to be under contract is Lot 11, another market rate rental building of up to 300 units. Lot 12, as I said, will eventually be a grocery store. We're trying to attract a urban grocer to actually come within this neighborhood. That sort of gives you the lay of the land on this particular site. We also have a 20-plus acre city park located on site as well. And like I said, we're walkable to downtown, to the south, to our entertainment district, Ybor City, which has a lot of workforce jobs and service industry jobs within walking distance in Ybor City, as well as Channelside, which is our tourist district. This is what it looks like, the L at Encore, 160-unit senior building, the Trio, 142-unit family building, 70% affordable, 30% market rate. The Reed at Encore, another senior building, and then our last building, the Tempo at Encore, which is now occupied. Once again, this is what the overall site looks like today before that commercial development takes place on the site. Some of the features that I'll talk about a little bit later is right down here in the corner is our district chiller building. We're producing air conditioning for this entire 12-city block. It's being piped to all of these buildings underground, which frees up the rooftops for solar. There's solar on top of each one of our roofs, which offsets our electric consumption, of course, and there's also a solar array located here. Over this entire lot here is underground storage of stormwater for the entire site. We collect every drop of rain that falls, and it's recirculated back to all of the lots to irrigate and all of the foliage for this particular site. So it's a highly sustainable community. It's a LEED Gold neighborhood development community. The LEED Gold, if you're not familiar with LEED, Leaders in Energy and Environmental Design, is one of the industry standards to achieve higher performing buildings as well as healthier buildings. This site, before we tore it down, had lead-based paint. It had asbestos. It had some PVCs located in the ground over here. All of that was able to actually be cleaned up. Our families living in those environments obviously produce health disparities that, are very different than people being able to live in an environment that's more conducive to raising healthier kids. And that's one of the reasons we actually redevelop these communities instead of simply renovating them, because they're isolated, stigmatized communities that over time, just simply needs a more modern facility. And also this particular site now being downtown yields itself to higher densities, a more complete diversity of uses. This is Florida's most diverse community by far. And when I mention diversity, I'm talking ethnic and cultural diversity, certainly, but I'm also talking about diversity in incomes, being mixed-use community, diversity in uses, being able to actually have those jobs on site that never previously was. This 28-acre site for 78 years sat as a single-use public housing community, over 28 acres for 78 years, completely off the tax rolls, isolated from the surrounding community because of the network of streets that all took people around the community and not through the community, because it was this isolated pocket of crime, this isolated pocket of poverty. That's where the low-income people were, quote, deposited. And as we redevelop this, it's so very important that you integrate this community with that diversity of incomes, cultures, as well as uses. Post build out, when the hotel and the office and the grocery store and all of that opens up, you will have just under 1,000 full-time permanent jobs located within this 12-city block area that for 78 years provided jobs for only 19 full-time permanent individuals. So an incredible transformational project on any scale. Specifically looking at some of the green features of Encore, of course we have electric charging stations in all of our parking garages, and our residents are buying electric cars. They're adapting to more sustainable living and lifestyles. We've got the solar panels, as I mentioned, over our stormwater retention vault that actually offsets our cost for the entire street lighting for the whole 28-acre site. So we literally pay nothing for the street lighting of this entire Encore campus, and we have credit left over that we apply toward our other public uses on site. This is our chiller building, high efficiency way of actually supplying this 12-city block development with sustainable and lower cost air conditioning to these communities. You can go into this building now, and this time of day those chillers are completely shut down. They're off. They're quiet. The only thing running in this chiller building today would be the circulation pumps, because out back we have 60 cylinders here. These are thermal storage units that are essentially large ice cubes, and we melt ice in order to cool the buildings. And it's an incredible, high efficient, works incredibly well. It's the type of application that's typically used for hospital campuses or university campuses, but very rarely, if ever, used for a mixed-use residential community like we're using it for here in Tampa. But a very key green feature that ensures long-term sustainability for our community. Our first building that we opened, we actually got LEED Gold on the Ella at Encore. Our second building we opened, we achieved LEED Silver. We're still waiting on our LEED credentials for our other two buildings that are actually open. So we have promised LEED Silver or higher on all of these buildings. And there's only one step above LEED Gold, and that's LEED Platinum. So that's some of our sustainability and green features. It's an amenity-rich community as well. All of our buildings have uses and amenities contained within that building. This particular buildings are two senior buildings. The Ella and the Reed actually have a visiting MD room for visiting physician or nurse practitioner or dietitian or any medical or health-related field individual professional. We actually have individuals rotating in. Every Wednesday could be a dermatologist, or every Monday could be a dietitian that actually comes in and is available to help our families identify any health issues that they're having and recommend treatments and therapies that they can actually start applying on their own, in terms of getting out and walking, et cetera. All of our buildings have a small movie theater. We purposely built in facilities and amenities that allow these families to come out of their individual homes, out of their parked cars and garages, and actually, get along with one another and actually meet their neighbors and recreate and become true neighbors, even though this is urban living. It's downtown, mid-rise urban living. Pool room, residents come down and actively use that, and there's computer centers in all of our buildings as well. The rooftop of the garage is actually the amenity space for our building as well. It has pools in all of our buildings. It's also the place where they can come and play shuffleboard and barbecue and just get along. Within our park and our vacant lots, while they're vacant, we've actually been programming that space intensely with musical concerts and outdoor movie nights and food truck rallies and pop-up events on a fairly regular basis, once again to bring families together and allow them to enjoy the community, to get them out of the house so that they can actually meet one another. It's a public art, music, history-rich community. All of our buildings have public art integrated on the building, in the building, throughout the community. This is an image of a bike rack. Everything is musical related because there's incredible history to this particular site. It's the site where Ray Charles lived when he first moved to Florida. He wrote his very first song, recorded his very first song while living on this site for 3.5 years. He writes about it in his autobiography. Ella Fitzgerald and Cab Calloway and Dizzy Gillespie and many, many people back during that era actually have roots on this site. So we wanted to bring that history back and present it in a fresh, way so that our families can actually appreciate this area and no longer look to what it had become, this stigmatized area of crime and poverty. Once again, public art integrated throughout the community. These particular art walls here actually tell the history, in pictures of that area over a 100-year period of time, decorating certain features. This is a gate that leads to the trash compactors, but it's a musical theme associated with that. Also, I'm originally from Memphis, so if you've ever been to Memphis, you've probably seen Graceland, and there's similar styles for the Graceland gates. Public art and music is very important to Encore, and it has very successfully been used to bring our families out and let them engage with one another. The last few slides here specifically focus on healthy lifestyle and active community features. All of our buildings also have fitness centers, including our senior buildings. Our seniors are active here. You have to be 62 or older to live in 2 of the buildings, which are designated just for seniors. And these seniors stay fit. We have, the treadmills and the pads. They organize water aerobics on certain days so that our seniors can actually, stay fit and live longer and healthier, less medicine-dependent lives, shuffleboard courts and pools. We actually have urban gardens or small planters in these senior buildings as well that allow them to grow tomatoes and peppers and cabbage and et cetera. This is a bikeable site. We actually have bike share on site. Scooter share is coming real soon to Tampa, which will also be available on site. And our families do take active use of it. Probably lastly, this is a tobacco-free community. This is a smoke-free community, not just the building, but the entire 28-acre area. It's a partnership with the local health department here in Tampa that actually partnered with us, and this became Tampa's first tobacco-free community, all 28 acres. Our families, have access to smoking cessation programs and other therapeutic access that actually allows them to stop smoking if they do. If they do smoke, they have to leave the site. They literally leave the site and go on city-owned land across the street away from this 28 acres in order to light up. And, it has not at all impacted from a negative standpoint our lease up. Our residents appreciate being able to live in a smoke-free environment. There's no cigarette butts to be discharged. You won't find an ashtray anywhere at Encore. And as a testament to that, these 3 ladies have lived at this site for 8 years. Mama in the middle there, this is the Strickland family. She is 105 years old. She turned 105 years old last year. Her daughter, who's this young lady, and her granddaughter, who's this young lady, they all are over 62. They all have lived at Encore for over 8 years now. And the grandmother, as you can see, doesn't wear glasses, does not have a walking cane. She walks on a regular basis. She is always visible in this community. Just love seeing them because it really speaks to, the walkability of the site when you can have this kind of family literally moving from Georgia in order to live in a healthy community. We're in the process now, my last note, we're in the process now of actually doing a health study, affordable housing and health study, so that we can actually interview individuals that live here, find out from them what their health was, what kind of medications they were on before they moved to Encore, what kind of change of lifestyle they have taken on since moving at Encore. Are they walking more? Are they, you know, coming out feeding the squirrels and the birds more? Are they, you know, getting off certain medications? Have their weight changed in a positive manner? Are they living and eating healthier? So that we can actually document over the years in statistical terms what we see, you know, with our own eyes as we, you know, interact with the residents who live at Encore. So that's my last slide, and I'll turn it back over to Rebecca now for any questions.
Excellent. Thank you so much, Leroy. Really great program, and appreciate you sharing those personal stories with us as well. We do have about 10 minutes for some questions that have rolled in through the course of the webinar. Speakers, you all should be unmuted now. This first question is for Emily, and you mentioned that you had a number of communities as part of the Build Health Challenge, and there was a caller who was interested in knowing how new communities can get involved in this program.
Thanks, Rebecca, and thank you for that question. We actually just opened a call for applications in February of 2019. So that round is actually underway for review. There'll be a selection process, and the new cohort, the third cohort, will get underway this fall. I will say there is not currently a defined date for a possible fourth cohort. Build, as I alluded to before, it is a funding collaborative, so we're at the discretion of the folks that come to the table each time. So hopefully there will be a fourth cohort or some iteration of some kind. We don't know that for right now, but in the meantime, what I would say is we have a lot of resources on the website that continue to be produced and shared. We're always looking for great partners across the country, and we do have periodically opportunities, for example, you know, something that might have to do with capacity building that might be targeted to a specific region or city that we oftentimes will offer. So if you're interested, I would ask that you sign up on the buildhealthchallenge.org website for the free newsletter and or on Twitter. Build has a profile there too. And I'm also happy to share my email at the end of this in case anybody has other questions or wants to get in touch.
Wonderful. Thank you so much for that clarification and additional information. Suzanne, this next question is from you. It came in through the chat, and it was in regards to community health workers and if there is a role in the Healthy Home Des Moines model for community health workers.
Actually, yes. We haven't utilized community health workers yet to date, but as we look at our long-term sustainability plan and how the program could be spread across our entire state, we see community health workers as being a vital partner in how that can roll out. So absolutely, it's on the top of our agenda list when we meet right now. Great question.
Great, thank you. All right, and Leroy, this one is for you. There's a question regarding sort of engagement of that initial population in the sort of planning and development of Encore, and if residents themselves sort of get a say or have a mechanism to give feedback on their community life.
Yes, absolutely. We have a extensive community engagement process that actually starts with the residents that live there. We don't start a redevelopment of this scale until the resident population is there in step with us. So 2 years prior to any relocation, we started meeting with the families, talking to them about a future redevelopment of the site. They actually help us select planners. They go through the design charrettes with us, give input on what amenities are important, what amenities are lacking in the community, what would make them want to come back to this community. When they are relocated, they go through an extensive counseling and services program that actually, first qualifies them for relocation, and once they get qualified, they actually get the option of choosing either Section 8 or being relocated to another community. Everybody who's relocated off-site to make way for this redevelopment is given first right to come back to these new communities, and many of their residents choose to come back. Most residents choose not to come back after 3 to 5 years of being off-site because they have chosen well, and they can appreciate the beauty of the new community and the conveniences of the new community, but they put down roots and they've chosen with purpose where to move to. So they're very engaged in the process and continue, to this day.
Great. Excellent that the community and civic engagement piece is so strong in the redevelopment effort. And one just sort of a logistical question for those that were less familiar with sort of the housing world. Can you give us just a brief overview of what LEED means?
Yes. LEED is a international standard of achieving sustainability and energy efficiency. The acronym LEED, L-E-E-D, stands for Leaders in Environmental and Energy Design. So when you go through a process of designing a building, whether it's an office building or home or residential multifamily building, there are certain criteria for indoor quality, materials that don't emit certain gases and odors. And when you build with those healthy, specifically chosen products because they're healthy, it allows families to live better and develop fewer cases of asthma and lung disease and so forth in future years. It's a way of building, with the purpose of building a healthier, more environmentally sustainable community.
Perfect. Thank you so much for that explanation, and interesting how that ties back into Suzanne's project and program. And then I have one last question that just popped up for Suzanne. It was in regards to the repairs of applicants. How does that work with those rental properties and getting approval from landlords or complexes and that sort of thing?
Oh, great question. I guess I did not touch on that. So the first criteria, there must be an active lease in place. And so, as I mentioned, we've had to bring in legal aid to help facilitate that. In order for us to go in and put private dollars, if you will, into this renovation, the landlord must sign an agreement with a minimum of a 2-year lease extension with no increase in rental cost. So that's how we guarantee that our clients won't be displaced after the renovations are complete. So those are really the two main criteria. I will say, that's a hard one to go after because you've got a lot of individuals who feel like this is the landlord's responsibility. And I would say our experience thus far has been, it's maybe taken Healthy Homes Des Moines to come in and do the first one, but then working with landlords, they've stepped up to do some future renovations themselves, or if it's in a larger building, that maybe we're working on something inside an apartment, but that they've stepped up to make some changes to the overall structure. So it's been a work in progress, but at the end of the day, Healthy Homes Des Moines was committed to the health of our children, and so we have tried to put up as few barriers as possible to have those remediations take place. Hopefully that answered the question.
Yes, you did. Thank you so much for that additional information. Really appreciate it. I think we have now addressed all of the questions, and it's in perfect timing as well because our hour is now up. But I do want to thank you all for joining us on today's webinar. A special thanks goes out to Emily, Suzanne, and Leroy for taking time out of your busy schedules to discuss your great work. Couple logistical things. We will be announcing our May webinar shortly, and I will be sending a follow-up email with a recording of this as well as the presenter's slides. So be looking for that probably later in the day. And I'm also going to throw in the AAC registration information if anyone is interested in attending our event and conference here in Denver in June. So just be on the lookout for that email. And with that, everyone just enjoy the rest of your day, and thanks so much. And presenters, if you have time just to stay on for about 5 more minutes with me, I'd appreciate it.